teams, Lauren and Rebecca here with Bizrok. In this week's video, we're going to talk about the post-op call and who should be doing it and when we should do it. Now, I know some of our overachievers are like, I call my patient like 16 times and for 16 days, and guys, that's great and I love your heart, but you don't need to do that, right?
You do not. You do not. Post-op call should take place the evening of the appointment, and that should actually, the first one, be by the provider. So guys, their patients are coming to you and they're investing a lot into their oral health, especially on sedated and surgical cases. So with that being said, I highly suggest the provider actually calling the patient the night after their appointment, just to check on them. And when you call, all you need to say is, hi, this is Dr. Smith. I'm just giving you a call to make sure everything is feeling great. If you need me, please let me know.
Yes.
Do you have any questions?
Yes.
And that is all you need to ask. And they will ask you questions if they have them. If they don't answer the phone, call the emergency contact, the number that was given to you for their ride that was there that day, and make sure that you can get a hold of somebody that way. If not, just leave 2 voicemails and then notate it that you did try to call. And then I would suggest that a team member, the assistant that assisted the doctor during the case, call the next day as well in a 24-hour call. After that, there's the only 2 calls that need to be made to the patient. If they need something, they will call you back, but make sure that the provider's placing that first phone call.
Yes. Well, and I loved your verbiage on that too, of if you need anything, please let me know. I wouldn't tell the patient to absolutely call you guys, because then you're going to get phone calls galore from your patients, right? And sometimes we get pushback from the doctors. They'll say things like, well, I don't want patients to have my cell phone. Guys, I know that, but you are a provider. You are a medical provider serving your patients. And so I always push back and I always ask our providers, I'm like, what do your patients deserve? They deserve to hear from their doctor.
They do.
They deserve to hear that you care about them. And if they call you in the future because they saved your phone number, because we have heard those stories too, you answer the phone, you politely take care of them, and you say, hey, Susie patient, listen, this is my personal number. I do ask that you respect my time with my family. Do you have our office number? I want to make sure that if you need me, you call our office and one of our team members will take care of you. It allows you to take care of them, serve them, but also kindly educate them that they need to call the office.
Yes. There are also apps. I believe Google, you can get a one-time phone number from Google, and there are other apps that you can utilize to get one-time phone numbers from. So utilize that if you don't want them to have your number. The other thing I would suggest is calling them from the emergency phone. If your practice has an emergency phone, just utilize that emergency number to actually call the patients. That way, when they call it back, they will get the emergency voicemail, and they will know at least that it was somebody from their practice giving them a call.
Yeah, love that. Any other important tidbits when it comes to the post-op appointment or post-op conversations?
Yes, we kind of hit on the emergency number just then. When you're handing your patients their post-op instructions, always write that number down on the bottom of the sheet or have it printed on there. It should always be available for a patient after a surgical appointment. We do not know what's going to happen. Sometimes they do have an emergency question and they need to get a hold of somebody right then and not wait until Monday if the appointment's on Friday. So always give them a number that they are able to utilize throughout that weekend.
Love that, which is why that emergency phone is so important.
So important.
And also it's so important that whoever is responsible for that phone at that time is actually answering it and has it on, because you need to be able to respond back to your patients in a very quick manner.
I always say within 30 minutes. And the voicemail should say that I will be returning your call within 30 minutes. And it's okay to let it go to voicemail if you want to hear the voicemail before you call the patient. And that is something that I've done a lot in the past. That way I can get all my information together before I call the patient, pull their chart up from home, get everything together before I give them a call back.
Love that. So guys, as always, if you need any additional help or support, please reach out to us. We'd be happy to walk through your post-op process and give you some of our best practices around that. As always, guys, we can't wait to see you and serve you soon.